Hello, ladies and gentlemen, this is Mr. Terfo, medicinal chemist in professional, and today I want to go to do some ANS pharmacology for the course Medicinal Chemistry-I associated with chapter 2. So let me try to do some important question on ANS or the drug acting on ANS. This question may help you to boost your knowledge of pharmacology of ANS as well as the structure-activity relationship associated with ANS. So if you are the pharmacy staff who learn this course, this question is very important for boosting your knowledge. Let me directly dive to the question and try to answer the question with a minor explanation. If you have any misunderstanding, you can contact me through the comment section, but try to click the bell icon of our YouTube channel so as to get an interesting video in your future career. So the question number 1 is associated with what type of receptor does acetylcholine primarily bind to the autonomic nervous system? A is beta adrenergic, B is muscarinic, C nicotinic, D alpha adrenergic. So the question says that which receptor does primarily bind to the acetylcholine in an autonomic nervous system? Be sure the muscarinic and the nicotinic also the one that can be initiated by acetylcholine neurotransmitter, which can be boosted by activity can be answered by acetylcholine, both nicotinic and the muscarinic. But here the muscarinic can be the one that is mainly targeted for autonomic nervous system. Here is the explanation. As you know, acetylcholine also binds to the nicotinic receptor at autonomic ganglia and the neuromuscular junction, but in target organ of the autonomic nervous system, especially at the parasympathetic effector organ. So it is primarily up to the muscarinic receptor. So among the given alternatives, the primary binding to the neurotransmitter, so-called acetylcholine, primarily binding to the autonomic nervous system, is receptor so-called muscarinic receptor. Question number 2, which class of drug is primarily used to block the effect of sympathetic nervous system? A, anticholinergic, B, a beta blockers, C, cholinomimetics drug, C, sympathomimetic drug. So the question is associated with the blocking effect of sympathetic nervous system. Therefore, cholinomimetic and the sympathomimetic drug is out of the answer. So the answer is either A or B. So the answer is definitely a beta blocker drug because they antagonize the beta adrenergic receptor to reduce sympathetic effect on heart and the circulation, and the so-called anticholinergic blocker, which is mainly a parasympathetic, sympathomimetic, enhances sympathetic activity, cholinomimetic also mimicking acetylcholine, which have an agonist activity rather than antagonist, but the question is associated with blocking, which is antagonist activity or effect on the sympathetic nervous system. So the answer is definitely the so-called beta blocking agent. So you guys, please try to subscribe our channel and click the video like button so as to the YouTube algorithm to know this video to reach the vast coverage of the student which need this video. Question number 3, what is the primary mechanism of action for atrophy? A, it is a beta adrenergic agonism, B, a muscarinic receptor antagonism, C, a nicotinic receptor antagonism, D, reuptake inhibitors or reuptake inhibition. Yes, you know that atropine, which is obtained from atropa belladonna, which is an alkaloid, and the primary mechanism of action is mainly associated with muscarinic receptor antagonism because this atropine block muscarinic acetylcholine receptors, which reduce parasympathetic activity. So the atropine is mainly known by muscarinic antagonism. So question number 3 is B. B is the correct answer. Question number 4. Which of the following is a direct-acting sympathomimetic agent? So the question says this one. A is ephedrine, B cocaine, C tyramine, D phenylephrine. So be sure this question is associated with a direct-acting sympathomimetic agent or agonists agents, which is mainly direct-acting. We have direct-acting, indirect-acting, and a mixed-acting sympathomimetic agent among the drug given here. The one which is associated with direct-acting is called phenylephrine, because phenylephrine is a direct-acting alpha-1 adrenergic, primarily indirect or mixed-acting. They release a norepinephrine or have some direct activity, and the cocaine works by blocking the reuptake of monoamine, which is the most important enzyme, monoamine oxidase, in the metabolism of catecholamine. So here the question is asking about direct acting sympathomimetic agent, so the answer is D. Question number 5, what type of drug is donepezil? Says the question is directly associated with the pharmacology of this drug. So what is the therapeutic category, or what is the drug categorized under? So donepezil, A is a cholinergic antagonist, B cholinesterase inhibitor, C a beta blocker, D alpha agonist drug. So have a look in deep and please try to classify the drug donepezil under which category this drug can be classified. I'm sure you say that cholinesterase inhibitor because this donepezil inhibit acetylcholinesterase, which increasing acetylcholine levels, mainly used for the treatment of an Alzheimer's disease. So it is an inhibitor of acetylcholinesterase. You know that acetylcholinesterase is an enzyme that used to break down acetylcholine neurotransmitter into this bioprecursor, so-called acetylcholine or choline and acetyl-CoA. So this drug can be classified under cholinesterase inhibitor. Question number 6. Which neurotransmitter is primarily involved in sympathetic nervous system? A. Acetylcholine, B. Norepinephrine, dopamine, serotonin is given. So the neurotransmitter primarily involved in sympathetic nervous system. Is it acetylcholine or norepinephrine, dopamine, or serotonin? I'm sure you all say that norepinephrine because it is primarily a post-ganglionic neurotransmitter of sympathetic nervous system. Acetylcholine is used by preganglionic sympathetic fiber and by parasympathetic postganglionic fiber. So among the given alternative, the one that is involved in sympathetic nervous system is so-called norepinephrine. So the answer is B. So you guys, I worked this question by simply using in English language because there is many foreigner student, the Sudanese student, there is a Gambella staff which didn't hear Amharic or Afan Oromo. That's why in order to compensate all you guys, the question can be done by in English language only, because our media of communication, our media of learning and teaching and methodology is also English. So if you have any misunderstanding, try to put your comment on the comment section. Question number 7. Which drug is used to treat asthma by acting as a beta-2 agonist? Albuterol, propranolol, atropine, and vasostigimin is given. So the drug that is beta-2 agonist and mainly used for the treatment of asthma is so-called albuterol, propranolol, atropine, vasostigimin. I'm sure you all say that albuterol is a drug that can be used for the asthma treatment because of the bronchodilator effect. Yes, so it is a selective beta-2 adrenergic agonist used as a bronchodilation effect for asthma, but propranolol is also non-selective beta blocker and can worsen asthma even. And the atropine is anti-muscarinic, and the vasostigimin is a cholinesterase inhibitor. So among the given alternatives, the drug which are beta-2 agonists and used for the treatment of asthma is called albuterol. So the answer is A. Question number 8. What is the pharmacologic effect of muscarinic agonist? A. Increasing heart rate, B. Bronchodilation, C. Increased salivation, D. Vasoconstriction. Please look the question in deep. What is the pharmacologic effect of muscarinic agonist? The question says like this: increased heart rate, bronchodilation, increasing salivation, vasoconstriction. I'm sure if you see this question in depth, you understand it is all about associated with salivation. Yes, because a muscarinic agonist mimic a parasympathetic activation, They increase the granular secretion, increase gastrointestinal motility, cause bronchoconstriction and bradycardia rather than bronchodilation or increase heart rate. Vasodilation can also occur via endothelial M3, but vasoconstriction is not typical. So among the given alternative, the muscarinic agonist can be associated with increasing salivation. So C is the correct answer. So still we are speaking about the medicinal chemistry-I chapter 2 in the pharmacology of ANS drug. So this question is very important for boosting your knowledge of medicinal chemistry-I as well as pharmacology-I, because ANS drug can be depicted in both pharmacology and the medicinal chemistry-I as per your curriculum. Question number 9. Which of the following is a selective beta-1 blocker? A. Carvedilol, B. Metoprolol, C. Propranolol, D. Labetalol. Look at the question, which of the following is selective beta-1 blocker? Yes. So which one? Carvedilol, metoprolol, propranolol, and labetalol. I'm sure this question must have two answers, I think, yes. Okay, let me see it. Yeah. The question metoprolol can be the best. The selective beta-1 adrenergic blocker at usual dose. The propranolol is non-selective beta blocker. Carvedilol and what called labetalol are block both alpha. Yeah, they are non-selective actually. Yeah. So the question is associated with selective beta-1 blocker. That's why the answer is B, metoprolol. But this labetalol and carvedilol also have non-selective. May block alpha and beta receptors. And the so-called propranolol is non-selective beta blocker, so the answer is correct. So-called metoprolol is the answer. Question number 10. What is the role of pyridoxysteroid in the treatment of myasthenia gravis or atony? It increases acetylcholine availability, block acetylcholine receptors, inhibit norepinephrine reuptake, and acts on dopamine receptors. Look at the question, what is the role of pyridoxysteroid, which is a derivative of vasosteroid, yes, is an alkaloid drug, mainly used in the treatment of myasthenia gravis. So, what's the role? It may increase acetylcholine availability, or it blocks acetyl receptor, inhibits reuptake, or acts on dopamine receptor. I'm sure you will say that increase acetylcholine availability because this pyridoxysteroid is a reversible acetylcholinesterase inhibitor. It prevents a breakdown of acetylcholine at the neuromuscular junction, so it can improve the neuromuscular transmission in myasthenia gravis and also sometimes in atony, because this myasthenia gravis and atony have some relationship, even if it have some difference. So this drug is mainly used for the increment of acetylcholine availability. Question number 11. Which of the following drug can cause urinary retention as a side effect? A. Beta-nickel, B. atropine, C. carbachol, D. pilocarpine. Look, the question, which of the following or which drug can cause a urinary retention as a side effect? Urinary retention is the side effect of which drug? The question says like that. Is it beta-nickel, atropine, carbachol, or pilocarpine? Yes, surely you say that atropine, because this atropine is anti-muscarinic that block parasympathetic stimulation of bladder, denusar, and leading to the urinary retention. Beta-nickel and carbachol are muscarinic agonists that promotes bladder emptying. Pilocarpine is muscarinic agonist primarily used for glucagon and xerostomia. So the drug that's mainly used for urinary retention as or the drug that causes urinary retention as a side effect is so-called atropine, which is obtained from Atropa belladonna. Question number 12. Which class of drug inhibits the synthesis of norepinephrine? Alpha agonist, beta blocker, adrenergic neuron blockers, cholinergic. So the question says that which class of drug inhibits the synthesis of norepinephrine? Yes, it is definitely adrenergic neuron blocker, because such drug inhibits the synthesis, storage, and the release of norepinephrine. Example include metyrosine, which blocks tyrosine release, and risperidone, which prefers the vascular, the vascular storage. Therefore, the drug that mainly inhibits the synthesis of norepinephrine can be associated with adrenergic neuron blockers. Yes, they inhibit especially synthesis, storage, in the so-called release of norepinephrine. Yes, so the answer is C. Question number 13. What is the mechanism of action for organophosphate insecticide? A. Nicotinic receptor agonism. B. Cholinesterase inhibition. C. Reuptake inhibition of norepinephrine. D. Muscarinic receptor antagonism. You know that this organophosphate insecticide is very, very poisonous, and let me also associate with the paralysis. Yes, they are very toxic. That's why maybe EPA nowadays some of them are banned from the market from using for insecticide. So their mechanism of action is mainly associated with a so-called cholinesterase inhibitor. So the best cholinesterase inhibitor can be organophosphate insecticide. So the answer is B. Organophosphate reversibly inhibit acetylcholinesterase, causing accumulation of acetylcholine at the nicotinic and the muscarinic receptor, which lead cholinergic toxicity. So, and the correct answer is B. So, you have to understand in that scenario. Which drug is known for its use in treating anaphylaxis? A. Epinephrine. B. Dopamine. C. Norepinephrine. D. Phenylephrine. Yes, anaphylaxis means prevention, as you know. Yes, so which drug is mainly used for the treatment of anaphylaxis? Yes, you all guys say epinephrine, because this epinephrine mainly stimulates alpha and beta adrenergic receptor like vasoconstriction, bronchodilation, and increased cardiac output. So make it the first line treatment for anaphylaxis. So the answer is epinephrine. So epinephrine is mainly used for the treatment of, or the first line treatment for anaphylaxis. So the answer is A. Question number 15. What type of drug is scopolamine? A. Muscarinic antagonism. B. Beta agonist. C. Cholinesterase inhibitor. D. Alpha agonist. Still we are asking on the alkaloid scopolamine. So scopolamine can be classified under which category? Is it muscarinic antagonist, or cholinesterase inhibitor, or alpha or beta agonist? Is it adrenergic agonist or adrenergic antagonist, or acetylcholine receptor agonist or antagonist? So the answer is definitely muscarinic antagonist, because scopolamine is anti-muscarinic agent that used for motion sickness. Yes, and also post-operative nausea, and also to reduce secretion, the power of surgery. So it blocks muscarinic acetylcholinesterase receptor. So scopolamine is the best example of muscarinic antagonist. So this muscarinic antagonist or muscarinic blocker is mainly used for even in order to avoid secretion prior of surgery. They can be also administered. They also can be used for reducing the motion sickness. So the answer is correct. Question number 16. Which of the following drug can lead to reflex tachycardia? Yes. Which of the following drug can lead to reflex tachycardia? A. Clonidine, phenylephrine, metoprolol, and carbachol. Yes. Which drug can lead to reflex tachycardia? Clonidine, phenylephrine, metoprolol, and carbachol. Yes, definitely it is phenylephrine, because as a potent alpha-1 adrenergic agonist, phenylephrine causes vasoconstriction and an increase in the blood pressure, so which can trigger reflex mediated tachycardia via the baroreceptor reflex. Yes, so the main what effects of phenylephrine is leading the reflex tachycardia. Yeah, so the answer is B. Question number 17. Which molecule primarily mediates vasodilation in the autonomic nervous system? A. Acetylcholine. B. Nitric oxide. C. Norepinephrine. D. Serotonin. Look the question. Which of the following, or which molecule primarily mediates vasodilation? Where? In autonomic nervous system. Is it acetylcholine, nitric oxide, norepinephrine, or serotonin? Yes, the answer is B, because this nitrogen mustard or nitric oxide can be mainly mediates vasodilation. Look, the endothelial release of nitric oxide is the main mediator of vasodilation in many blood vessels. So acetylcholine can stimulate endothelial cell to produce nitrous oxide, but nitrous oxide is a primary factor that relax vascular smooth muscle constrictor. So the primary mediation of vasodilation, especially in autonomic nervous system, is nitric oxide. Question number 18. The action of ephedrine is primarily through which receptor? Alpha 1, beta 2, both alpha and beta, or muscarinic? Be careful, ephedrine is used for asthma treatment, so which receptor can be support the action of this ephedrine? Is it ephedrine selective or non-selective drug? Be careful, you have to remember the scenario of selectivity as well. Yes, if you have such concepts, definitely this ephedrine is what? Both alpha and the beta selective, because it is a mixed acting sympathomimetic drug. Yeah, so ephedrine is a mixed acting sympathomimetic. It has a direct agonist activity at alpha and the beta adrenergic receptor, and also indirectly increase the release of norepinephrine. Thus, it acts as both alpha and the beta, including beta 2 receptors. So the answer is both alpha 1 and beta 2. Question number 19. Which drug is contraindicated in patients with asthma due to its bronchoconstrictive effect? Albuterol, propranolol, ipratropium, epinephrine. Yes, which drug is contraindicated in a patient with asthma due to its bronchoconstrictive effects? Is it ipratropium, epinephrine, propranolol, albuterol? Yes, you guys may answer like propranolol. Yes, this propranolol is a non-selective beta blocker that block beta 2 receptor in bronchial smooth muscles, which can cause bronchoconstriction and worsen even asthma. Yes, so it can have a contraindicated for the patient having asthmatic or asthma therapy. Yeah, so this propranolol is non-selective beta blocker which can interact with anti-asthmatic drug like. Question number 20. What effect does pilocarpine have on eyes? Dilation, constriction, no effects, increased intraocular pressure. Which or what effect does pilocarpine have on eyes? The question say like that. Dilation, constriction, no effect at all, increased intraocular pressure. Yes, definitely it have constriction because pilocarpine is a muscarinic agonist that cause pupillary constriction or meiosis and also constriction of ciliary muscle, which increases the outflow of an aqueous humor and usually lowers intraocular pressure. Therefore, pilocarpine is a muscarinic agonist that have constriction effect on our eyes. Question number 21. Which class of drug would you expect to have the most pronounced effect on heart rate and cardiac output? Yes, which class of drug would you expect to have the most pronounced effect on heart rate and cardiac output? A. Alpha blocker, B. Beta agonist, C. Cholinesterase inhibitor, D. Anticholinergic drug. So a drug have a pronounced effect on heart rate and the cardiac output can be classified under. Yes, there can be beta agonist drug because they directly stimulate beta 1 receptor, which is found in our heart, and they increase heart rates, so-called chronotrophy, and contractibility inotrophy, which raises cardiac output. So anticholinergic can increase heart rate by blocking vagal tone, but have less direct effect on contractibility. Cholinesterase inhibitors increase parasympathetic activity and tend to slow heart rate. So alpha blocker primarily affects vascular tone. Therefore, the beta agonist is mainly used for increasing the heart rate or chronotrophy and the contractibility or ionotrophy. So the answer is B. Question number 22. Which of the following is the common side effect of beta blocker? Hypertension, bradycardia, tachycardia, dry mouth. Here the question is an adverse effect of beta blocker or the side effect of beta blocker. Yes, you all guys say bradycardia. So this beta blocker produces heart rate by antagonizing beta-1 adrenergic receptor in arterial node and the myocardium. In the other common effect including reduced contractibility, fatigue, if no selectivity or bronchoconstriction are there. Therefore, the main side effect of beta blocker is so-called bradycardia. Question number 23, what is the effects of adrenergic agonist on peripheral blood vessels? Dilation, constriction, no effects, both dilation and constriction. So what is the effect of adrenergic agonist on peripheral blood vessels? It is so dilation, constriction, no effects, both dilation and constriction. Yes, it is all about constriction because this adrenergic agonist can cause either vasoconstriction or vasodilation depending on which adrenergic receptor subtype is activated. If alpha-1 activation causes vasoconstriction, beta-2 activation causes vasodilation, and the net effect depends on the drug's receptor selectivity and their vascular bed involved. Therefore, this drug or alpha-adrenergic agonist have a constriction effect on the peripheral blood vessels. So the answer is B. Question number 24. Which cholinergic drug can be used to reverse the effect of neuromuscular blockers? Yes, which cholinergic drug can be used to reverse the effect of neuromuscular blockers? A. Atropine, neostigmine, vasostigmine, the so-called curare. Yes, the drug, it is a cholinergic drug which mainly used to reverse the effect of neuromuscular blockers. Here's the one that mainly associate on nicotinic receptor. That means so the answer is B. It is neostigmine. Yes, neostigmine is a reversibly acetylcholinesterase inhibitor used to increase acetylcholine at the neuromuscular junction in the reverse non-depolarizing neuromuscular blockage. The atropine may be co-administered to counter muscarinic side effects, but the neostigmine, which is given for the reversing the neuromuscular effect of neuromuscular block effects. Question number 25. Which of the following drug acts as anticholinergic agents? It is dicyclomine, donepezil, rivastigmine, and galantamine. This also directly associated with the pharmacology of anticholinergic agent. So which agent or which drug acts as an anticholinergic agent like dicyclomine, donepezil, rivastigmine, or galantamine? So the answer is dicyclomine because this drug is an anticholinergic or antimuscarinic agent mainly used to reduce gastrointestinal smooth muscles spasm. And the donepezil, rivastigmine, and the galantamine are the cholinesterase inhibitors or cholinomimetic drug mainly used for the treatment of Alzheimer or neurological disorder. Yes, so the best drug here is dicyclomine. So the answer is A. Question number 26. Vasostigmine is primarily used to treat asthma, glaucoma, myasthenia gravis, anticholinergic toxicity. Yes, vasostigmine is mainly used for the treatment of what? Yes, definitely it is associated with anticholinergic toxicity because this vasostigmine is a reversible anticholinesterase inhibitor that can cross the blood-brain barrier. So it is used to reverse central and peripheral effect of anticholinergic overdose. So this vasostigmine can also be used as antidote. Yes, it is an antidote, so it is anticholinergic toxicity associated with antidote of the central nervous system as well as peripheral nervous system because vasostigmine is a lipophilic drug which easily crosses our blood-brain barrier, which is a policeman for our brain. Yes, so the answer is definitely D. Question number 27. What type of drug is phenoxybenzamine? Selective beta blockers, non-selective alpha antagonist, beta agonist, and cholinergic antagonists. So definitely the answer is non-selective alpha antagonist, because phenoxybenzamine is an irreversible non-selective alpha adrenergic blocker used for example to control hypertension and the catecholamine effect in the pheochromocytoma. So benzamine is a non-selective alpha agonist, which is mainly used for controlling of hypertension, the catecholamine effect in pheochromocytoma. Yes, so the answer is B. Question number 28. Which drug would most likely induce meiosis or pupil constriction? Phenylephrine, timolol, pilocarpine, atropine. Which drug would most likely induce meiosis or pupil constriction? Phenylephrine, timolol, pilocarpine, atropine. Yes, sometimes I give you time to guess the answer before I give you the answer. Yes, that's why I'm somewhat giving some 5 to 6 seconds. Okay, so I'm sure you all say that pilocarpine. So this pilocarpine is a muscarinic agonist that causes pupillary constriction or meiosis by stimulating the sphincter pupillatia muscles. So it can be the correct answer is so-called pilocarpine. Yes, pilocarpine is associated with pupillary constriction or meiosis. Question number 29. Which agent is an alpha-1 antagonist? Prazosin, isoproterenol, clonidine, carvedilol. Which agent is an alpha-1 antagonist? Prazosin, isoproterenol, clonidine, or carvedilol. Yes, here is prazosin, because it is a selective alpha-1 adrenergic antagonist used for the treatment of hypertension and what we call relief urinary obstruction. So it is an alpha-1 antagonist drug mainly used for treatment of hypertension and urinary obstruction. So the answer is A. Question number 13. Which neurotransmitter is released by postganglionic sympathetic neuron? A neurotransmitter mainly released by postganglionic sympathetic neuron: acetylcholine, dopamine, norepinephrine, serotonin. Yes, the most important neurotransmitter mainly released by postganglionic sympathetic neuron. The question is like that. Yes, you all say C. Yes, norepinephrine, because this norepinephrine is mainly released from postganglionic sympathetic neuron. So it is the primary neurotransmitter released by the most postganglionic sympathetic neuron. Acetylcholine is released by preganglionic sympathetic fiber and all parasympathetic postganglionic fiber. Therefore, the question is associated with postganglionic sympathetic neuron. So the answer is norepinephrine. Question number 31. Which of the following is centrally acting antihypertensive agents? Doxazosin, clonidine, amlodipine, propranolol. Which of the following is centrally acting antihypertensive agents? Doxazosin, clonidine, amlodipine, propranolol. Yes, this clonidine. Yes, clonidine is a centrally acting alpha-2 adrenergic agonist that lower the blood pressure by reducing sympathetic outflow from CNS. And doxazosin is a peripheral alpha-1 blocker. Amlodipine is dihydropyridine calcium channel blockers, and the propranolol is non-selective beta blocker. So the question can be associated with centrally acting antihypertensive agent, and that is definitely alpha-2 adrenergic agonist drug, that is clonidine. Which drug is selective agonist for alpha-2 adrenergic receptor? So this is definitely already answered. Yes, already answered, because the questions R2 and SR2 is almost they are similar. So The answer is clonidine, yes. Because we are clonidine centrally acting alpha-2 adrenergic, we say. Here is also agonist for alpha-2 adrenergic receptor, so the answer is clonidine. This is selective alpha-2 adrenergic agonist that reduces sympathetic outflow from the CNS. So those two questions are very, very related and asked in two different ways. Question number 33. Which of the following drug can cause rebound hypertension effect? Which of the following drug can cause rebound hypertension effect? Rebound hypertension means once the patient can get relief from hypertension, they stop the medicine, then the blood pressure become raised. That is called rebound. So which drug can cause this scenario? Is it clonidine, metoprolol, diltiazem, or enalapril? Here is associated with clonidine because stopping clonidine abruptly can lead to the rebound hypertension due to sudden loss of central alpha-2 mediated sympathetic inhibition, causing a surge in sympathetic outflow. So still we are speaking about clonidine. Yes, clonidine can cause rebound hypertension if it can be stopped suddenly. Yes. So the answer is A. Question number 34. The primary effect of cholinergic agonist on the heart is increasing heart rate, decreasing heart rate, no effect at all, increasing blood pressure. Yes, the primary effect of cholinergic agonist on heart. What is the effect of cholinergic agonist on our heart? Is it tachycardia or bradycardia or what? So this can be associated with decreasing our heart rate. Yes, cholinergic agonists activate muscarinic M2 receptor in heart, increasing the vagal tone and slowing the sinoarterial node, producing a bradycardia. Yes, so reduce the arterial ventricle conduction, AV conduction. Yes, so the so-called bradycardia can be associated with cholinergic agonist drug. So the answer is B. Question number 35. Which of the following is used to treat hypertension? And it's also a dual alpha and beta blocker. A propranolol, B so-called carvedilol, C atenolol, and E is labetalol. So here is the question is given: the drug that treats hypertension but have both alpha and beta blocker. Yes, it is non-selective drug for alpha and beta, but it can be used for the treatment of hypertension. So which drug? In one or other way we are speaking in the past question, so that is definitely associated with two drugs. One is carvedilol and the other one is labetalol. So both carvedilol and the labetalol block alpha and beta adrenergic receptors. Carvedilol is commonly used for in heart failure and hypertension, so-called non-selective beta and alpha 1 blockage. Labetalol is used for the hypertension, including hypertensive emergency and pregnancy that have mixed alpha and beta blockage. Propranolol is a non-selective beta blocker without alpha blocking activity. Atenolol is beta selective. Therefore, among the given alternative which can be have alpha and beta blocking effects can maybe carvedilol and labetalol. So the answer is B in that as well. To answer. So check this question more from your pharmacology concept. Again, question number 36. Which drug is indicated for the treatment of bradycardia? Atropine, carbachol, phenylephrine, and prazosin. The drug that's used for the treatment of bradycardia. Yes, this atropine. Yes, atropine is anti-muscarinic that block vagal or parasympathetic effect on the heart. So which increasing heart rate and used acutely to treat sympathomimetic or sympathomatic bradycardia. So atropine is the answer used for the treatment of bradycardia. Question number 37. The primary action of beta-2 adrenergic agonist is bronchoconstriction, bronchodilation, vasoconstriction, analgesia. Yes, what is the primary action of beta-2 adrenergic agonists? The drug which is work on adrenoreceptor, yes? Yes, the primary action is mainly through of what we call bronchodilation, yes? Beta-2 especially, this beta-2 adrenergic agonist relax the bronchial smooth muscles via beta-2 receptor activation, producing a bronchodilation. That's why they are used as a bronchodilator in asthma and COPD, or obstructive pulmonary disease. Beta-2 adrenergic agonist relax bronchial smooth muscles via beta-2 receptor activation and producing a bronchodilation. So the answer is beta-2. Yes, beta-2 adrenergic. Which of these, question number 38, which of this drug primarily increases the availability of acetylcholine at the neuromuscular junction? Neostigmine, ephedrine, pralodoximine, and vasostigmine. Yes, the drug primarily increases the availability of acetylcholine, especially at the neuromuscular junction, which means the drugs that increase or enhancing the acetylcholine to activate nicotinic receptor, that it means. Yes, it is neostigmine, because neostigmine is a reversibly acetylcholinesterase inhibitor that increases acetylcholine at the neuromuscular junction to improve the muscle strength, commonly used to reverse non-depolarizing neuromuscular blockage. And in myasthenia gravis, vasostigmine is also inhibits acetylcholinesterase, but used mainly for the anticholinergic toxicity, because it can easily cross a BBB or blood-brain barrier. Neostigmine does not cross as readily, and the pralidoxime reactivates acetylcholinesterase inhibitor by organophosphate, and the ephedrine sympathomimetic drugs. So the drugs that mainly used for increasing or the drugs that primarily act on increment of acetylcholine at the neuromuscular junction is the so-called neostigmine. Question number 39, which drug can be used to reverse the effect of organophosphate poisoning? Atropine, phentolamine, neostigmine, epinephrine. Yes. In the previous also we are doing this question. Yes. The drug that reverse organophosphate poisoning is atropine. So atropine is anti-muscarinic that block the effect of excess acetylcholine at the muscarinic receptor in organophosphate poisoning. Yes. It is given alongside with pralidoximine, which helps reactivate acetylcholine at the nicotinic site. So the answer is A. Question number 14. Which of the following is not direct-acting cholinergic agent? Methacholine, beta-nicoline, pyridostigmine, and carbachol. Yes, the drug that does not directly acting on an agonist agent is the so-called parasympathomimetics. It is indirect cholinergic agent, a reversible acetylcholinesterase inhibitor, whereas methacholine, beta-nicoline, and carbachol are direct-acting muscarinic or nicotinic agonists. So the drug pyridostigmine is not direct-acting cholinergic agent. So the answer is C. Somewhat the font size is very small, but in order to explain, we make the font very minimal. Yes, you guys, I'm sure the question is very interesting for you guys, so please subscribe Atom Academy so as to get more question in the future as well, and like it, share for your fellow friends, and let me dive together for the next 20 or 25 questions as well. Question number 41, which of these drugs can be used to treat overactive bladder? Dicyclomine, tolterodine, scopolamine, phenylephrine. Yes, which drug can be categorized under the treatment or under the category of overactive bladder treatment? Dicyclomine, tolterodine, scopolamine, or phenylephrine. Yes, definitely it is B, because this tolterodine is anti-muscarinic agent used to reduce bladder spasm and treat overactive bladder by blocking M3 receptor in the detrusor muscles. And this dicycloamine is used for gastrointestinal spasm, cobalamin for motion sickness, and the phenephrine is alpha-1 agonist. So the drug that used for the treatment of overactive bladder is tolterodine, B. Question number 42, the mechanism of action of sildenafil. Yes, you know that it's an anti-impotency drug. So this anti-impotency drug can have mechanism of action associated with beta agonism, nitric oxide signaling, muscarinic antagonism, alpha receptor antagonism. So what do you feel? Which one is the best answer for you guys? Yes, surely you say B, nitric oxide signaling, because sildenafil mainly used for inhibition of phosphodiesterase type 5, PDE5, which prevent the breakdown of cyclic guanosine monophosphate produced downstream of nitric oxide, enhancing smooth muscle relaxation in the corpus cavernous and the pulmonary vasculature. Therefore, this sildenafil, the mechanism of action mainly associated with nitric acid or nitric oxide signaling, or it is an phosphodiesterase 5 inhibitor. Yes, so the answer is B. Question number 43, which drug class would you use to manage anxiety and the panic disorder with their effect on the autonomic nervous system? Yes, which class of drug used to manage anxiety and the panic disorder due to their effect on autonomic nervous system? May you feel anxiety or management of anxiety like CNS drug, but the question is the one that have effect on autonomic nervous system which lead anxiety. A is beta blocker, B is cholinergic agents, alpha agonists, prostaglandin. Which drug class would be used to manage anxiety in the panic disorder due to their effect on autonomic nervous system? Yes, it is a beta blocker, because the blunt sympathomimetic symptom of anxiety like tachycardia, tremor by beta blocking adrenergic receptor, particularly useful for performance anxiety in the somatic symptom of panic. So it's mainly associated with beta blocker. Yeah. Question number 44, dopamine exhibit which type of adrenergic activity at low dose? Dopamine, which is the best example of catecholamine neurotransmitter, exhibits which type of adrenergic activity at low dose? Alpha 1, beta 1, dopaminergic, all of the above. The dopamine at low dose especially exhibits which effects? So definitely it is all, because at low dose dopamine primarily stimulates D1 or D2 dopamine receptor in the renal, mesenteric and coronary vascular beats, causing vasodilation. At intermediate dose it adds beta 1 cardiac effect, and at high dose it produces significant alpha 1 mediated vasoconstriction. Therefore, these all are the effect at low dose of dopamine. Question number 45. The primary clinical use of epinephrine is the treatment of hypertension, allergic reaction, asthma, heart failure. The primary clinical use of epinephrine is the treatment of what? I think we are answering in some question also. Yes, may the question have different form, but the answer may be almost similar. Yes, it is allergic reaction. Yes, epinephrine is the first line treatment for anaphylaxis. Stimulate alpha and beta adrenergic receptor, causing vasoconstriction, bronchodilation, and increased cardiac output. Therefore, it is allergic reaction which leads asthma. So, epinephrine is the drug that treats allergic reaction. Question number 46. Which drug would be avoided in a patient with hyperthyroidism due to a potential exacerbation of tachycardia? Yes, which drug can be avoided in a patient with hyperthyroidism due to a potential exacerbation of tachycardia? Propranolol, atenolol, metoprolol, and pindolol. Yes, the drug which can known by exacerbation of tachycardia. Therefore, it must be avoided in the patient having a hyperthyroidism. Yes, definitely it is pindolol, because this pindolol has intrinsic sympathomimetic activity, partial beta agonist, and in hyperthyroidism patients, a pure beta blocker without ICA has a propranolol, metoprolol, and atenolol is preferred to blunt excessive sympathetic-driven tachycardia. Pindolol, a potential agonism can potentially worsen tachycardia in that setting. So, this intrinsic sympathomimetic effect, that means ICS, intrinsic sympathomimetic activity, ICS. So the answer is correct. So D is correct answer. Question number 47. Which agent is primarily used for urinary retention treatment in post-operative patients? Neostigimen, atropine, tamsulosin, and beta-nicotine. Which agent is primarily used for urinary retention treatment in the post-operative patients? Yeah, it is beta-nicotine, because it is a direct-acting muscarinic agonist that simulates destructor muscle construction and promote bladder emptying, commonly used for post-operative urinary retention and neurologic areas. So the answer is D. Question number 48. Which of the following can result in increased blood pressure as a side effect? Beta-adrenergic, alpha-1 agonist, cholinergic, muscarinic antagonist. Yes, which drug or which agent mainly associated with increasing blood pressure, especially as a side effect? Yes, the answer is alpha-1 agonist, because this alpha-1 agonist stimulation causes peripheral vasoconstriction, which increase systematic vascular resistance and may resist blood pressure. So alpha-1 stimulation causes peripheral vasoconstriction, which increases systematic vascular resistance and can raise blood pressure. So the answer is B. So alpha-1 agonist agent may raise blood pressure as side effect. Question number 49. Which drug is the treatment of choice for managing acute glucagonema? Timolol, atropine, acetazolamide, pilocarpine. So which drug is the best drug for the acute glucagonema management? I'm sure you say timolol, because this timolol is a topical non-selective beta blocker and is commonly used as a first-line agent to lower intraocular pressure in acute glucagonema by reducing acute humor production. The pilocarpine may be used in some acute angle closure situation once intraocular pressure is lower. Acetazolamide is a systemic carbonic anhydrase inhibitor. It's also used as an adjuvant therapy. Atropine is contraindicated as it is worsen angle closure glucagonema event. So timolol is the best answer, which can be used for managing acute glucagonema. Question number 15. Which of the following is non-selective adrenergic antagonists? Atenolol, propranolol, metoprolol, and carbidiol. Which one is non-selective adrenergic antagonist or adrenergic blocking or adrenolytic drug? Yes. So which drug can be classified under adrenergic blocker? Yes, the answer is B, which is called propranolol. Yeah, propranolol is non-selective beta-adrenergic antagonist that block both beta-1 beta-2 receptor. Atenolol and the metoprolol are beta-1 selective blockers. Carbidiol block beta receptor and also alpha-1 receptors. So it is mixed, but not non-selective beta antagonist in the classic sense. So the non-selective adrenergic antagonist, more of the answer is almost B. But in absence of propranolol, maybe the so-called carbidiol can be selected as based on the explanation you see. Question number 51. Which one is not alpha-1 agonists? Metraminol, methoxamine, Phenylephrine, none. The question says which one is not alpha-1 agonist? Metraminol, methoxamine, phenylephrine, none. Yes, you have to omit enda here. Yes, you have to omit enda. So the answer is almost none because all the three listed drugs, metraminol, methoxamine, phenylephrine, are primarily alpha-1 adrenergic agonists. So the answer is D. Question number 52. Which one is not true regarding receptors? Which one is not true regarding receptor? Beta-2 receptor are located on smooth muscles. Beta-2 involved in relaxation of smooth muscle. Beta-3 receptor is located in the bone adipose tissue. Beta-2 involved in the simulation of lipolysis. Yes, the question is which one is false? Like, so among the given alternative, the one that is not true is D, because D is said beta-2 receptor located on a smooth muscle and mediates the smooth muscle relaxation, which is true. Beta-3 receptor are primarily on the bone adipose tissue and mediate thermogenesis or lipolysis, which is true. While beta-2 can contribute to a metabolic effect, and the main beta-2 receptor subtype responsible for stimulating lipolysis adipose tissue is beta-3 and the beta-1. So starting beta-2 as a lipolysis stimulator is incorrect. So the answer is definitely D. Question number 53. Which one is true on enzyme involved in catecholamine metabolism? Yes. Which one is true on enzyme involved in catecholamine metabolism? A. Monoamine oxidase, MAO, and the catecholamine O-methyl transferase compound are involved. They are distributed throughout the body with high concentration found in liver and the kidney. MAO is associated with primary with outer membrane of mitochondria. All definitely the answer is all, because all are the correct answer. Yes, all are the correct answer because all the statements are true. MAO and the COMT are both metabolizing catecholamine. They are widely distributed in the liver and the kidney. MAO is located in the outer mitochondrial membrane. So the answer is all are true. D. The other one is which one is catecholamine? Norepinephrine, epinephrine, dopamine, noradrenaline. The answer is I think all are catecholamine because they have catecholamine, benzyl ring having 2OH moiety. Therefore, the answer is all. Yes, the answer is all because norepinephrine, epinephrine, dopamine, noradrenaline, adrenaline are all catecholamine. This is easy question for you, so you can answer as is. Question number 55. Which one is mismatched? Yes, which one is mismatched? A. Bradycardia means decreasing cardiac rate at low dose. Tachycardia, increased cardiac rate at high dose. Antisecretory agent administered prior to surgery. Antidotes, xerostomia. So which one is mismatched? Or which one is wrongly matched? That it means. Yes, definitely you say D because D is mismatched. Antidote is not xerostomia. Yes. As you know, antidote are an agent that counteract poison or drug effect. Xerostomia is associated with dry mouth, so antidote does not be matched with xerostomia. It is a symptom or side effect, not an antidote. So the other pair are sensible. Bradycardia increase heart rate, decreasing heart rate. Tachycardia increasing heart rate at dose. Antisecretory agent administered prior to surgery. Example, anticholinergic like glycopyrrolate is best example of antisecretory agent. So the answer is D. Question number 56. Which muscarinic antagonist used to treat cycloplegia? Yes. Which muscarinic antagonist used to treat cycloplegia? Atropine, cyclopentolates, hycosine, endamine. Yes, definitely endamine because both atropine and the cyclopentolate are muscarinic antagonists used to produce cycloplegia, paralysis of ciliary muscle, mydriasis, population, dilation of pupil for ophthalmic examination. Hycosine or scopolamine can also be used produce this effect, but it is less commonly used specifically for diagnosis of cycloplegia. So the answer is cyclopentolate and the hycosine. It is not atropine. So D is the correct answer. Question number 57. Which one is true regarding phasostigmine? A. Used as antidote for overdose dosage of anticholinergic. B. Used in the treatment of glucagon, especially in topical application. C. With other cholinergic drug in CNS has been studied for the use of treatment of Alzheimer's disease. All are the choice, so which is true regarding phasostigmine. So be sure and try to understand each alternative and try to select the best. Yes, the answer is all, because this phasostigmine is a reversible anticholinesterase inhibitor that crosses blood-brain barrier, that is used as antidote for severe anticholinergic toxicity and can be applied topically for glucagon historically, and also release centrally acting cholinomimetics that have been investigated for Alzheimer therapy. Therefore, all are the answer. Question number 58. Which one is true regarding acetylcholinesterase inhibitor? They are indirect-acting cholinergic agonists used in the treatment of myasthenia gravis, employed as agriculture insecticide and nerve gas warfare agent, used in investigational therapy for Alzheimer's disease. Yes, which one is true regarding this one? Yes, the answer is all, because all listed statements are true regarding acetylcholinesterase inhibitor, are indirect acting cholinergic agonists. They are used for the treatment of myasthenia gravis. Many organophosphate insecticides and the nerve agent are irreversible acetylcholinesterase inhibitors. The reversible ACH inhibitors are also used for investigational and clinical therapy of Alzheimer, like donezepam, rivastigmine, and the galantamine can be classified under this. Therefore, all are correct statements regarding ACH inhibitor. Question number 59. Which one is incorrectly matched? Plasma cholinesterase, liver, plasma cholinesterase, false cholinesterase, RBC cholinesterase, bound to red blood cells, RBC cholinesterase, false cholinesterase. That. So which one is mismatched, or which one is wrong? That I mean, you know that plasma cholinesterase is so-called false cholinesterase and mainly produced in liver. So A is correct. And the cholinesterase is false. Yes, of course. RBC cholinesterase bound to red blood cells is correct. RBC cholinesterase is so-called true cholinesterase, is not false, therefore it is mismatched. Question number 16. Which one is true regarding carbachol? Less readily hydrolyzed, has profound effect on both cardiovascular and GI system, used in the relief of urinary retention after operation, of course, used to reduce intraocular tension of glucagon. So, which one is true regarding this drug? Yes, I'm sure you say all, because this carbachol is a cholinesterase that is less readily hydrolyzed by cholinesterase, longer acting, produce pronounced muscarinic and some nicotinic effect on cardiovascular and the GI system, can be used for urinary retention and the GI atony, in some antagonists, and they used topically to reduce intraocular pressure in glucagon. Therefore, all are true regarding the drug. Yes, this drug is less hydrolyzable in when compared with acetylcholine. You know that it can be produced by using the concept of structure-activity relationship from acetylcholine, because acetylcholine have less advantages in clinical application due to their ester and amide functional group, which is oral bioavailability very low. In order to reduce that, by using SARS concept, we get carbachol, which is less hydrolyzable, mainly produced by carbamylation of acetylcholine, as you know. Yes, so you have to understand this manner. Question number 61. Which drug used via inhalation as an effective diagnostic agent for the diagnosis of asthma produced using SARS, structure-activity relationship of acetylcholine? A. Methacholine, carbachol, betanicol, pindacin. The drug which can be produced by using SARS of acetylcholine, mainly used for effective diagnostic of asthma, and they are administered via inhalation, which one and how it can be produced? I'm sure you all say methacholine, because this methacholine can be produced by using SARS, especially beta substitution of the ethylene bridge of acetylcholine neurotransmitter. Yes, So methacholine is acetylcholine analog used by inhalation as a potential challenge. Test to diagnose asthma because it provokes bronchoconstriction in hyper responsive airway. Yes, can be produced by simply substituting the methylene at beta position rather than at alpha position. Therefore, it is the best drug. Question number 62. Which one is false regarding cholinergic receptor? Nicotinic is ionotropic, muscarinic metabotropic. M3 is located in the exocrine gland and the smooth muscles. Muscarinic and nicotinic receptor activated by ACH. None. Which one is false regarding cholinergic receptor? Nicotinic is ionotropic, which is mainly used for ion channeling. Muscarinic, which is G-coupled protein, therefore metabotropic. M3 is located in exocrine gland and the smooth muscles, which can be associated with production of sweet. Yes, of course. Muscarinic and nicotinic receptor both activated by acetylcholine neurotransmitters. Therefore, none is false. All are true. Therefore, the answer is E. The answer is E because all are correct. Meaning all statements are true. Nicotinic receptor are ionotropic, muscarinic are metabotropic or GBCR. M3 is found in exocrine gland and the smooth muscles. Those receptor types are activated. Therefore, it is correct answer. Question number 63. Which one is true regarding physiology of autonomic nervous system? The sympathetic system associated with thoracolumbar division. Sympathetic system evoking fight or flight reaction in emergency. The parasympathetic system associated with craniosacral division. Parasympathetic system permits digestion and conservation of energy. And none. Which one is false? Which one is true? Yes. Which one is true of physiology of autonomic nervous system? Yes, try to check the so-called the answer because all listed statements are true. And there is no alternative that say all. So you must have write all in this place. I think it is typing error. Yeah, it is typing error because all are true. So you say E all rather than E none. You say that E all. Or you can change the question like which of the following is false regarding the physiology of ANS. So in that manner you can correct by yourself. But all the statement you see in the slide is when the alternative is true. The somatic system is thoracolumbar division, mediated fight flights, and the parasympathetic system is craniosacral division, the promote digestion. That means so. Question number 64. The autonomic nervous system or ANS innervates smooth muscles, cardiac muscles, exocrine glands, or the autonomic nervous system innervates or activates smooth muscles, cardiac muscle, exocrine gland, or it's very easy question for you. I'm sure if you see the slide. Yeah, the answer is all. Yeah, that's the autonomic nervous system innervates smooth muscle, cardiac muscle, the exocrine gland, regulating involuntary function like vascular action, heart rate, and secretion. So the answer is all. Yes, you guys, I'm sure you are interested with the question of medicinal chemistry and the pharmacology in combination. Now the course more and having a great in your exam as well. So subscribe, like, and share our video so as to get interesting video in the future as well. Question number 65. The synthesis of acetylcholine done by using which precursor? Tyrosine, phenylalanine, serine, glycine. Yes, which amino acid is very important for the synthesis of acetylcholine? I'm sure you all say tyrosine because this aromatic amino acid is very important for the synthesis of acetylcholine. The other one is question 66. Maybe this is the last question for our this chapter. According to structure activity relationship, acetylcholine, which factor is decreasing the therapeutic effect? SH, in which nitrogen atom was replaced by arsenic, phosphorus, and sulfur, increasing ethylene bridge to pentene, carbamylating the acetoxy group, addition of the methyl group on the beta carbon to the quaternary nitrogen. Which one decreasing the therapeutic effect of acetylcholine? If you remember, we say that the quaternary amine or quaternary nitrogen cannot be substituted by as arsenic, phosphorus, and the sulfur, and the carbon like, because this quaternary nitrogen is very important and acts as a pharmacophore for the drug. Therefore, if you substitute nitrogen atom by this element, the activity can be decreased. So A is the correct answer. Increasing ethylene bridge to pentene means, yeah, we can. It's possible because there is 5 carbon atom rule, which is possible to increase up to 5. So this one doesn't decrease the activity. Carbamylation of acetoxy group, even it can increase the activity. You know that carbachol can be produced by carbamylating reaction of the acetoxy group, which are potent than that of SH. Addition of methyl group on the beta carbon of quaternary nitrogen, yes, methacholine can be produced by this scenario, which can be used for asthma treatment. So except A, all are correct. So A is the answer. So thank you very much for your attention. All question is this one like this. I am sure ANS Pharmacology or ANS Chemistry is very clear for you guys. So please subscribe Autonomic Academy for getting interesting video like this. Please, if you want to get a study tip like how we study, how we improve our grade in the class, how we work research for graduate students, and many wisdom can be there on HowinTube. Please try to subscribe HowinTube as well. If you need a video in Afan Oromo language, for those who listen Afan Oromo, like there is a CookTube which is very interesting, having more than 10,000 subscribers. So try to subscribe HowinTube if you are interested in Afan Oromo video of different courses. For your attention overall, thank you very much. This is all about Medicinal Chemistry Chapter 2 question. If you have any comment, suggestion, please try to depict on the comment section. If you have any question again, if you want to contact me, please, I put the Telegram link on description and the phone as well as email address also there. Please try to communicate me in person in whatever condition you need. So this is all about today. Thank you very much.